Hi, thanks for joining us today. Today we have a special program with Andrew Rice. Andrew, you've worn a lot of hats, former state senator, founder of Non-Doc, which was an online news service, and now starting executive director of Teen Recovery Services. It means a lot to me because I think, as we both know, Oklahoma is being overrun with addiction. We hear about opiate overdoses. We hear about how hard it is for people to get in recovery from addiction, but we have so few resources here in Oklahoma. Can you talk about the mission of Teen Recovery Services and how you may fit into the equation?
Sure, absolutely. So I joined the board last year, volunteer board, and the executive director was getting ready to retire, so ended up being offered that position this year. Teen Recovery Solutions is unique in that the core of what it does is it runs a very small recovery high school. And recovery high schools were really born out of treatment centers around the nation, saying to therapists and parents and educators back in the communities where teens would come from, really our research shows that putting them back in the high school that they were in before, the relapse rate is very high. So to experiment with creating an alternative school type of setting where it's centered around recovery, around students and staff and supporters who are committed to a life of recovery and sobriety. And there's about 35 or so of these schools that are accredited nationally, and ours is one of them. It's called Mission Academy.
Okay.
And so that is a way for therapists and guidance counselors and staff to be able to create an environment for those kids to have the support they need to finish their education, get a good education, and have the behavioral health support they need. The other component of what we think is important, and this is what we do, is what happens after 3 o'clock on a school day. And another model that's out there that's very active in Houston, which we borrowed from, is the alternative peer group model, and it's just what it sounds. Can you create an alternative peer social environment for these teens? So they're not being drawn back into the peer relationships that they had that were unhealthy and destructive, but peer-to-peer of teens committed to recovery. So we have a program that starts after school for our students and also for teens at high schools in the community who are struggling as well but don't go to our school, for them to have after-school activities, sort of the youth group model with after-school activities and the 12-step approach sort of blended into a unique model with therapists. And then they have after-school activities like rock climbing and ping pong and going to the Y to work out. And then in the evenings, there's all different types of therapy groups for the teens and their parents. We have groups where the teens and parents are together with our facilitators. We have ones where the parents meet alone, a Mother's Al-Anon group, boys 12-step groups, girls 12-step groups. And then social activities, going to Top Golf, going to Main Event, having a sober house party that's organized at one of our families' houses. So really from 8 a.m. on Monday morning until Saturday afternoon, most of our students in particular time is spent in a structured, supportive environment educationally and therapeutically to be in recovery, and for their families. They're just sleeping in their own home at night,
Right.
you know. So in a way, I had a grandfather who's raising one of our students say it's almost like inpatient treatment, but they come home every night and sleep at home. So,
Which is a big gap in Oklahoma. There is no inpatient long-term treatment center, and it seems like the literature says long-term is what it's all about. Long-term is what gets you recovery from addiction in higher numbers. It's why physicians are kind of mandated to do long-term treatment programs.
yeah.
So it seems like that's what this high school is doing, is it's putting people into this environment long-term, covering the bulk of the day.
Yeah, and really all the adequate resources are there. A very dedicated staff, very dedicated board members, community partners. We have teens that are referred to us that maybe they're in a more severe situation where they need to go to a true inpatient facility, or maybe they're not quite to the point where they need our services. And then we have a bunch of partner agencies that can help us with other needs. So it's all there for the success. The teens got to be willing to want to live a different life, and we create an environment where a life of sobriety and recovery is more fun, if not more fun, than using drugs or alcohol.
Right.
And the other key component of our model is for the parents or guardians to be actively involved in the recovery process along with the teen. It's not just, I'm going to send my kid there and fix them. It's no, The family needs to get into recovery. The family needs to deal with whatever enabling issues are going on and codependency, whatever it may be, so the whole family can get well. Because this is a type of behavioral health, mental illness, substance abuse. So there's no shame in people being sick.
Right.
You know, the services are there to get well. So it's a great model. I mean, we've tweaked it in some ways to sort of be our own approach, but we're borrowing from the best practices of what's been successful in Texas and Minnesota and Ohio, Colorado, these other places where it's going on as well.
We've got to be to the point where virtually all of us knows a neighbor, a family member, a friend, some family that may need these services. If somebody's interested, how would they find you? How would they learn
That's
about
a great
the school?
question. We do free assessments for anybody. So any teen that the teen and or family is worried about them can come call our clinical staff, and we will assess the teen privately, and then bring the parent or guardians in and assess them and sort of try to get an idea of where they are, what the severity or lack of severity of the issue is, whether they meet the criteria for our programs or whether we need to refer them to another place. So that's available for anybody. If you are out there and you or someone in your community, family, friends, people, coworkers at work are having a teen in crisis, please call us, and we can do that. The other thing that's unique about the school is really the school is a bit of a privilege in that it's not just a place you automatically get into, say, if you've gotten in trouble at your other school, or you just sort of want your parents off your back, or the parents just sort of want, us to fix them. We have to see a demonstrated effort of wanting the life of recovery from the teen and the parents and the guardians. So it's an idea of it's a committed, protected environment where we don't want someone just coming in who's not really committed to changing and have that influence our other students.
Right.
So it's not your typical alternative school where maybe the system, frankly, in my opinion, can sort of dump people.
Right.
This is really more of, you're in crisis and we can help, but we need to show you're serious about it because the resources you're going to have wrapped around you are valuable, and we don't want you to be not serious about it and have that affect our other teens who are really committed to a sober environment. And our kids are great, creative, bright, dynamic kids who keep their sense of individuality. They're very creative. They're artists. They're not changing who they are. They can still be a lot of the ways they want to be an individual, but in a healthy way, in a way where they don't have to abuse drugs and alcohol to regulate their emotions and deal with life. So I feel very lucky to get the opportunity to work in it. I myself am in long-term recovery, and I've never have ever had the opportunity to for my job, work in the environment like this. And so it was too important or meaningful of an opportunity for me to pass up to really be able to work with a great staff and help them.
Right. So like the diabetic that needs to be taking its medication, his or her medication, you want people motivated to fight the disease of addiction, and families that are committed as well.
Absolutely. And I think, Ed, that's a great point, because really what we're trying to do is the more success we have, not only are we saving families and saving lives, we are growing the young people's recovery community of Oklahoma City and the surrounding areas to where they can make positive impacts on other young people, and they can see other families who are struggling that may feel stigmatized or we're the only ones who are dealing with this, can see there's a lot of hope and recovery around them. So the more that we are able to be successful, that maybe other future problems with kids and their families can be caught a little earlier. They can get into the recovery process quicker than having to bottom out maybe as severely as some of our students and clients have had to. So there's no shame in it. I mean, addiction is rampant, not just alcohol and drug addiction. Gambling addiction is a huge issue in Oklahoma now. Right. There's all other forms of addiction and escaping issues. So there should be no shame in seeking help. If anybody in our community, we don't shame breast cancer victims. We don't shame people with diabetes it's another form of an illness that they can have much worse social consequences for families and workplace and relationships. But please don't ever hesitate, whether it's us, Chance to Change, whatever it may be, to access the services that are in the Oklahoma City area.
There's nothing else in medicine, it seems, where you you write a prescription, somebody's a diabetic and you say, just take your medicine and we'll see you back in a year. Yeah. It has to be long-term and everybody working together. So this just seems like really filling a hole, and it's wonderful.
It's a great program. We do monthly lunch and learns, which are not fundraisers. They're just we have lunch that we invite the community to come, RSVP, come in, have lunch with us, hear a little programmatic stuff about what we do, and then hear from a couple of our students, sometimes the parents there.
Right.
And it's a great way to learn about what we do. And so the second Wednesday of every month on our website, teenrecoverysolutions.org, there's information about how you can come in and just learn about what we do. It's a free lunch once a month.
Andrew, where is the school?
The school's up on North Classen, just east of Nichols Hills, north of the Chesapeake Energy campus. It's an old battery warehouse that Chesapeake Energy bought when they were expanding their properties, 4, 5, 6 years ago. And they recently donated the facility we were leasing it from them, and now we own it. They gave it to us, which is great. So
this can't be cheap. I mean, you must need resources. If people want to help, if people want to donate to the school, or they like the idea and they want to help, how would they do that?
Yeah, there's many different ways to help. Obviously, donations help us quite a bit. We don't get any state or federal money for it, so we're a nonprofit private school and 501c3. So we charge tuition. Very few of our students currently and historically are ever pay the full tuition. We have some, but most have some form of financial aid that we provide as a school. We don't have external financial aid. Cash donations are a big help. We're cheaper than some of the very sophisticated, expensive recovery in-treatment patient facilities or boarding schools outside of Oklahoma. Those can be $75,000, $80,000 a year to send your child to get help. So it's much cheaper than that. And like I said, we've got, and then we also have a fee to be part of that alternative peer group program. And we have students, all of our students in our school are required to be in the alternative peer group program. We also have students from other area high schools who are in that program. And that's a great value. I think our fee is $800 a month. And again, we have people who pay less than that because of their means. But they're getting anywhere from 6 to 7 hours equivalent of therapy for them, their children and their family a week. So they're getting what would really be thousands of dollars worth of behavioral health therapy from trained experts. And social environment and 12-step groups and support groups. Of course, the 12-step groups are outside of our model. They're volunteer. So it's a great value for our community. The free assessments.
Are there opportunities for people to volunteer?
Yeah, we have we have a yoga teacher in the community that we know who comes in and volunteers and teaches yoga. In fact, today the class is going on. I think right now at the school. We have art teachers who come in, and Untitled Art Gallery here downtown does a lot of stuff with our students because we're an arts integration program. So we do arts integration every day in our curriculum. So they donate a lot of their time and materials to do projects with them down at their space here. So really we're up to explore anything, any sort of internships in different industries and different types of jobs. We want our students to go off prepared about what they're excited about to pursue at the next level. So we're looking to have more robust relationship with the area universities because as they have students that are going to need sober options on those campuses, that's an area where we're working to build those relationships.
I believe so. Do you have an annual event coming up?
Yeah, we do. We've typically done like a dinner banquet, like a lot of nonprofits do in the fall. We've switched it to a lunch this year. And the sort of focus of the program will be several of our students and a parent will get up and tell their stories with a message from me and some of our board members. It's a lunch. It's at the Oklahoma City Golf and Country Club on Thursday, September 22nd. And there's information on our website, teenrecoverysolutions.org, about how you can buy a ticket for the event, a sponsorship. And that's our biggest sort of our biggest event of the year of bringing in charitable money to help with our mission.
Great.
And on our website, you can download our annual report to see specifically about where all of our money goes and how we spend it. And
fantastic.
We're audited every year.
And that website one more time
is? It's teenrecoverysolutions.org.
Great.
The school's called Mission Academy, and you'll see information about the school as well there. And
Andrew, thank you so much for the work you're doing, and this is wonderful.
Thank you. Well, I appreciate you having me on, and we really urge anybody in the community who has any concern about someone in their family or someone in their family just to call us, and if we can't help, we can always get them with the right organization.
Great.
Great.
Thank you very much.
Thank you.
And thank you for watching.